Welcome to the module on insurance, benefits, and services. This module discusses the importance of and timing for discussing patient needs that extend beyond medical care, namely insurance, benefits, and services. These are intrinsic to healthcare and important to the patient's overall well-being. This module provides resources and tips to help you discuss these areas with families. It provides quality improvement strategies and ideas to apply in PDSA cycles. Will youth have access to insurance, benefits, and services when they reach adulthood? How will they access or pay for them? Youth, particularly those with special health care needs and their families, will benefit from having such discussions sooner rather than later. Practices help by having these conversations early and by providing information sources as needed. Continuous health insurance is necessary to maintain care and to avoid lapses in insurance coverage that could leave youth vulnerable to pre-existing condition clause exclusions. Social services optimize the individual's quality of life and maximize his or her potential. Physicians, working with care coordinators, social workers, and other ancillary staff, can provide information to help guide the patient and family through the complicated system of adult benefits and services. It may be helpful to schedule a transition care planning visit to accomplish this. Encourage families to find answers to questions like, how long can the child stay on the current plan, whether public or private? What criteria must be met or paperwork completed for the youth to stay on the existing plan or join a new plan? Paperwork may include adult disability determination. Is there a waiting period or pre-existing condition exclusion? Encourage youth and families to ask their specific carrier about their unique situation to fully understand possible exclusions. What other options are available if circumstances change and the current plan is no longer an option? For example, if the child ages out, or if income or assets change. Does the patient need to apply for Medicaid in order to access other services or waiver programs? Is Medicaid and/or Medicare an available and beneficial option, perhaps as secondary coverage? For patients with special health care needs, such programs may be a backup to an existing private plan or to help pay for deductibles or services such as transportation or diapers. It is important to weave conversations about insurance into the visit to help teens understand terminology and how to maximize insurance coverage. The project-developed handout, Do You Understand Insurance?, facilitates such discussions. These conversations should begin early, around age 14, for patients with special health care needs. Here are some resources to help families understand insurance, including project-developed handouts and materials. Take a moment to review them now, or locate them as needed under the Tools tab. Here are some websites with insurance resources and other healthcare funding options to explore and share with families. The adult social service system can be challenging to navigate and is different from obtaining child services. The process may involve numerous phone calls, paperwork, follow-up, and appeals, all requiring time and persistence. Therefore, it is important to encourage patients and families to 1. Explore and apply for benefits early. For youth with special health care needs, discussions could begin as early as age 14. Families may want to use A. Existing relationships with social workers through such avenues as the family's school, hospital, medical home, or specialist teams for advice on the best approach for gaining access to specific programs. B. The assistance of the Department of Human Services Family Case Management and Family Community Resource Center. And C. The transition timeline, which describes programs and ages by which to apply. It is a helpful tool for families to track their progress on this journey. 2. Encourage families to reapply for social services if denied the first time. 3. Suggest they seek help from other families who have completed the transition process. 4. Above all, it is important to support and encourage families to not give up. Next, you will view a video clip featuring the experts who developed this course. When investigating adult social services, consider the youth's current and future needs for income support, educational plans, employment, housing and independent living, community activities, and transportation. Youth with special health care needs may require additional services and preparation time to optimize their health. To prepare for discussions, it is helpful to have a basic knowledge of major programs in order to connect patients with needed services. Use the project-developed brochures shown here to learn about various services and agencies. The brochures are excellent resources for families. In particular, the Guide to Adult Benefits, Services, and Resources lists commonly used statewide services with contact information and websites. Use the links provided for a closer look. Here are some strategies to guide your discussions. First, refer to the Transition Checklist for Teens and the Transition Checklist for Parents and Caregivers to help patients and families determine areas of need. Next, provide resource materials as suggested in this presentation and direct the youth and family's attention to the most critical areas. Finally, consider incorporating service identification and enrollment into the youth's transition goals. Here are some resources to facilitate discussions about adult social services. The project-developed handouts provide an overview of statewide programs. Practices may also develop their own list of local resources. The Illinois Lifespan Directory is an excellent source for identifying options in your area. Check out these resources now or after the training under the Tools tab. What is your practice's level of performance concerning discussions about adult insurance and services for youth approaching transition? Do you routinely elicit patient needs and provide information sources? To measure your practice's effectiveness, use the data collection tool provided in this course, which includes the chart review questions shown here. The Aims and Measures grid specifies the aim, question, and calculations for measurement. Note that while this course recommends that discussions about insurance and social services begin at age 14 for youth with special health care needs, the data collection question focuses on youth age 17 and older. If measurement identifies opportunities for improvement, then here are some potential barriers and improvement ideas to help bridge the gaps. There are more in the Barriers and Ideas for Change grid. Refer to your printed copy of the grid as you work through PDSA cycles to test ideas that you and your staff think will work to bridge gaps. Discussions about adult benefits and services are unlikely to be hot topics with teens. However, teens must begin assuming responsibility for their own health care, including making decisions about and preparations for benefits and services as they make the inevitable transition to adulthood. In the words of Abigail Van Buren, if you want children to keep their feet on the ground, put some responsibility on their shoulders.